I'm very pleased to welcome you on behalf of Jean Friday, one of my very good friends, who is our president. She's busy illustrating the fact that we all have to be careful and not fall down, because her husband fell down and he's done something bad to his knee, and that's the only reason she isn't here to introduce you and to introduce Eric Kingson. One of the things that experiences I had recently was to introduce our Congressman, Pat Meehan. And he said, well, he didn't want us to be worried because they weren't going to do anything to touch Social Security or Medicare for senior citizens, he wanted us to believe. And so I said, Congressman, we are deeply insulted by that remark. Deeply insulted. To think that you could stand up here in front of a group of senior citizens and think that we don't care about our kids and our grandkids. I'm glad to say he got a little bead of sweat on his upper lip. I've known Eric Kingson also for a long time. He's been working on Social Security for more years than he cares to admit. He thought it was all done, all wrapped up, all saved and secure. Guess what? I remember my dad, who also was very active in the old National Council for Senior Citizens, and he said, you know, any social program may need to be changed from time to time, but let it be done by its friends, not by its enemies. And Eric Kingson is one of its best friends, professor of social work at Syracuse University, active for a long time, and it is my pleasure to introduce him to this audience. Eric Kingson.
Basic message. Social Security and Medicare are under attack, and Medicaid, in ways they have never been under attack. It's really remarkable. The core social benefits are under attack today. They're under attack by an idea that somehow this great nation can't afford to provide basic social benefits for its people and for its children and grandchildren. That somehow we can afford all these tax cuts. We can afford 2 wars where we send young people off to fight, but we don't support them with tax increases. We can afford all sorts of things. We can afford to bail out the banks, but we can't afford Social Security, Medicare and Medicaid. And then the third point to be made is all of us, every one of us, have to send messages to our representatives in Congress. We have to get on radio. When we hear the foolish things being said or the good things being said on radio, we have to be part of moving it. We have to tell our children, our grandchildren, great-grandchildren at the Thanksgiving table to be active. It's critically important. And there's a broad message that many groups, I think, are coalescing around right now, which is we should be talking about jobs, not cuts, and making the people who crash the economy through their financial manipulations, making them pay. It's time to change the way politics as usual is being done. So that's it. I'm done. Goodbye. That's about as much as I really have to say. So we have a program that works. I don't think I have to tell you that. I'm not going to dwell on that. This is the program Americans value more than anything, Social Security. It's a program, by the way, that many people have fought, people who are well-known and not so well-known, to create, to keep. Among the most well-known, actually, was Alice's father, Nelson Cruikshank, who worked for labor, handled labor's occupational safety, health, and Social Security portfolio for many years, and was one of the prime parents of Medicare. So we have a program that works. It's not in crisis, and it never has and never will be a cause of the federal deficit. In spite of what we hear, in spite of what they want to insinuate, this is a program we pay for out of dedicated revenues. We hope that will continue. We pay for it out of dedicated revenues, and it's a program that makes a huge difference in everybody's life, including every child born in America. In many, many ways it makes a difference. Social Security is the basic life insurance we have for children. It's the most important source of income going to homes where grandparents, relatives, great-grandparents are raising grandchildren. It's the most critical source of income. It's a program that, for those of us who receive Social Security benefits, roughly 2/3 of us receive half or more of their income from it. And it's a program that's very modest, about $13,000, $14,000 a year in benefits on average. I can go back to this, but I'm just saying, we know it works. It works for Pennsylvania as well, including 2.5 million people who receive benefits each month, and $2.7 billion that flow into the Pennsylvania economy through Social Security. Same story for Medicare, and pardon the New York thing in here. I meant to update that last night, but I slipped. But basically, this program has immeasurably improved the quality. So here we have a system that works, and we have a system, and I say this all the time, that gives expression to values. And I think we forget to say this and tell the American people know this at one level, but we need to be saying it, because the folks who don't like this system say, let's privatize it. Let's let people put it in their pockets. And can you imagine if it was privatized 20 years ago? What would have happened? Or if it's privatized tomorrow, what would happen to our children and grandchildren? You know, but Americans have a right to own it. They have a right to their own bank account, not to Social Security. This is an undue use of government, beginning with Alf Landon, who ran against Roosevelt, saying that the money that was being collected from Social Security was worthless IOUs, something I think another president used more recently. But what we miss sometimes, or we don't emphasize, is how this gives expression to values we hold as a country, as a people. The idea that we have obligations, religious and otherwise, to our parents. We have a responsibility to care for ourselves, to protect ourselves against loss of income, and also, in doing that, to be protecting our children, our family, and others, and an obligation to our neighbors, something we don't talk about today. We have to revise again as a concept, that this program underwrites dignity, and underwriting dignity of every human being is critically important. And we need to speak to that, I believe. And in many ways, it gives expression to the beloved community that Martin Luther King talked about, where we're all part of God's people. We're all part of one people, and where poverty, homelessness are simply unacceptable because it's outside the bounds of human decency. This is what informs this system, and it's critically important that we maintain that. This is what existed before Social Security. The poor law, the poorhouse, was the fear, particularly of single women, that that would be where they would end up. Social Security eradicated that. Young people today don't know that. I think we know that, having lived through it or been closer to it, but it did eradicate that. So today we have a system that actually works. It pays benefits every month to 55 million people. It protects all of our children, almost all, against the death of a parent. How many people here lost a parent when they were young? Yeah. And how many people lost a spouse when they had young children? Yeah.
That was a lucky audience.
Yeah, it is. Yeah, well, it's lucky not because you raised your hands, because a lot of people didn't. Many of us have experienced that. This is the basic protection that we have. And it's not in crisis. In 1982, there was a crisis. Those of you who remember the Greenspan Commission back then. I was staffed to it. I was staffed to the 5 Democrats who were appointed by Tip O'Neill mainly. And back then, there really was a crisis. If Congress didn't act in 1983, early in 1983, Social Security benefits would have had to have been reduced. Because by law, Social Security cannot pay out benefits, pay out full benefits if it doesn't have enough revenue coming in to pay for it. It has no borrowing authority. So Congress had a real problem in front of them because none of them really wanted to be members of Congress the day they sent out a note saying, oops, we're going to have to shave benefits by 10%. Doesn't work. So they fixed the program quite well, and they put it on a good stead. Then it's in good shape to today. Today we have a system that can meet every obligation under our best estimates for 25 years. After that, it's roughly 25 to 20 cents short on every dollar Americans have earned. It's not belly up as the opponents of Social Security would like you to think. It has an ongoing revenue stream from payroll contributions that keeps the system moving into the future. Now that's something we have to address. But to put it in perspective, it's equivalent to the revenue the federal government will lose if the Bush tax cuts are extended to the top 2% of American households. Households that receive $250,000 or more. Now, if anyone is in here who earns more than $250,000, I apologize, those are the choices. It's equivalent to the income we would save, or the income we would bring into the system if we said all Americans should pay the Social Security payroll contributions on all their earnings, as should their employers. That would essentially address the long-term financing problem. This is not a big problem. It is simply a matter of politics at this point, and scrapping the cap is one way of addressing it. But here's what we've got. We've got this ideology masquerading as self-righteous grown-upism called austerity. And we're seeing it around the world. Austerity budgets are squeezing people. So we have this attitude that we have to reduce government spending today for a deficit that's out in the future. That argument pulls away from the capacity to invest in jobs, invest in schools, invest in building new roads, construction work, invest in research that we need to grow this economy 20 years in the future. It's a very short-sighted, and it threatens, once again, social benefits, and it also protects the very people who crashed the economy. They talk in, I would say, alligator tears, crocodile tears. They say they want to protect future generations. And to protect future generations, they suggest what you got to do is cut Social Security, Medicare, and Medicaid protections for those future generations. I talk about it and I think about it, and I'm not being facetious, I think about it as protecting future generations of Wall Street's barons. It's not our future generations. It's not that's being protected. It's the income, the class privileges, the income positions of those who are very well off today. So here's the deal. The deficit agreement said about $1 trillion is going to be cut out of the existing budget. It said that we're going to create this super committee, and it's mandated to take $1.2 trillion out of the deficit over the next 10 years, out of the federal budget, either by cuts in benefits, cuts in defense, increases in revenues in some way. And if that happens, Congress has to vote on it, yes or no. It's kind of like they're all like going to join hands and jump forward or jump off the cliff, whatever you think. And if it doesn't happen, there's an automatic trigger. And the trigger will automatically cause a $1.2 trillion rescission sequester, half of which would come out of defense, half of which would come out of non-defense programs, except programs focused on low-income people, Social Security, Medicaid. These programs are protected. A number of programs are protected. Medicare is partially protected. It would be cut, the provider payments would be cut probably at some level, but there's a limit to that. So that's what we face. And so the idea of the trigger was this was supposed to be so bad that members of Congress are going to want to do something. Here are the outcomes. And this is all going to happen probably even sooner than November 23rd. We're going to see some proposals coming out. The story in Washington is, yes, the deadline's November 23rd, Thanksgiving, but The Congressional Budget Office needs this information earlier so it can score it, so it can tell us how much we're going to save by each of the proposals. So one option is what they call a grand bargain, I call a not so grand bargain. This is the idea that not only do they meet the $1.2 trillion in deficit reduction goal, but they go beyond it, and they throw everything into it. And they probably throw they certainly throw Medicare and Medicaid into it, and they very possibly throw Social Security into it. I'll talk about specifics there. They violate the promise that they've made that they will never cut the benefits of current beneficiaries, and instead they put in place a cut in the cost of living adjustments. Because seniors have been getting, and people with disabilities have been getting too much in their COLAs in the last 2 years. Right? Oh. People in Washington kind of, there's been no COLA for 2 years, but that's too generous. In the future, we have to shave the COLA. So that's a part of it. Raising the Medicare age to 67 is what there's a large discussion going on about this. Crazy. The opposite wrong direction. So that's one possibility. Another possibility is a kind of limited deal with smoke and mirrors. They reach some agreement on specific cuts, and then they mandate congressional committees to come back with cuts or revenues within 6 months. So they kind of get out of it as a face-saving deal, but they don't quite deal with it. The other way is what I would call as a mini deal. The sequester, the cuts that are automatic, that have to half come out of defense and half come out of other spending, is $1.2 trillion if they agree to nothing. But if they agree to $500 billion, I mean, not a lot of money, right? $500 billion among friends. Everett Dirksen used to talk about, this was the days when you had conservative Republicans, but who had a degree of respect for government, for other people. Eric Kingson used to talk about $1 million here, $1 million there, and pretty soon you have a lot of money. We're up to $1 trillion here, $1 trillion there, and pretty soon you have a lot of money. A mini deal might cut $500 billion through changes in Medicare, Medicaid, social spending, maybe a few revenues, modest revenues, by getting rid of the tax benefits on yachts, things like that. Again, sorry if any of us have yachts, but that's what they're resisting, a tax on yachts, wealth taxes. So it might make a few changes and then leave half of it or so for sequester, for the automatic cuts in defense and in other spending, and say they've done the deal and go forward. And the last one is really, from my point of view, it's the best option, and it stinks. It's that there is no deal. Republicans walk away from this because they don't want to put a penny of taxes into dealing with the deficit, the projected long-term deficit. It becomes any kind of tax increase, any kind of revenue, even even removing tax deductions on, well, yachts, jets, business jets, is unacceptable. They walk away from the table. And then what we have is these automatic sequesters, $600 trillion out of defense, $600 trillion out of other spending. The reason I say it's the best one is that they don't really go into effect until 2013, and it allows us to focus on that during the election. It also requires half of the money to come out of defense, so it protects other spending much more significantly. So that's what we're looking at. The message, again, I believe today is, and I think it's tied to many things, there's a need for jobs. If we put Americans back to work, we'll deal with a lot of our problems. Revenues will increase. The capacity of our economy will grow, and that should be our first priority. Don't tell us, and say this with, don't tell us that we have to cut our kids' benefits 40 years in the future, even if these benefits don't need to be cut. Don't tell us to protect the future. We have to do that when we or some of our families don't have jobs and they have kids and it's not protecting their future. Focus on getting jobs, getting people working. Do not cut these programs and these policies. And it's time to ask those who really can't afford it to pay. And to pay no more tax holidays for the very well off. It's time to put our resources, we're a very rich nation, there's no reason why we can't afford these programs and can't afford to invest in good research that grows the economy, invest in good schools and all the kinds of things that make a society good. And at bottom, this isn't just about benefits, it's really about a way of life. And I think the American dream, such as it is at risk today. But the American dream is a good dream, and it builds on this notion that we're all part of something. And we do things in families, we do things in communities, and we do things through government to help us all move forward together. It's not just about benefits, it's about the kind of society we want and the commitment we need to have to each other. So with that, I will stop.